Hayes, tell us a little bit about your background and how you got into spine surgery.
Originally, I'm from New York, from Queens, New York, and I've been working in the medical field since 1990. I was an X-ray technician before I went to medical school, and then I liked orthopedics. I worked for an orthopedic surgeon, and then I went back, got my undergraduate degree at Manhattan College in New York, and then I went to Cornell Medical School, where actually I met Dr. Siddiqui. We were medical students together. And then after my training at Cornell, I did my residency at Long Island Jewish in North Shore Hospital. That's where I met Dr. Grandy.
Dr. Hayes, how did this center come together?
Dr. Siddiqui and I have had the same philosophy since we've been residents and medical students, where we met in medical school. This center basically came together. A hospital recruited us to come down here into Florida, and then our philosophy was basically a full-service spine center where we can treat patients from start to finish. If they needed injections or if they needed physical therapy, we can treat them. If they needed surgery, we can treat them. So we built this center on that philosophy that it's a full-service spine center where we can treat pretty much any spinal disorder. And we developed this center in 2006. It took about 2.5 years to build the facility.
This is a special center. There's no other like it. Am I correct?
Yeah, down here in Florida, there's not many facilities where you can get, minimal treatment right up to tumor surgery. So the unique thing about our practice is that we use surgery as the last resort, yes, but this is a full-service spine center in that we provide all the conservative care from start to finish. And I would say 4% of our patients wind up not having surgery. So the interesting thing about our facility is we have physical therapy, we do on-site different types of interventional procedures. Dr. Siddiqui and I are also experts in endoscopic surgery, and we do a lot of teaching and education here as well.
Probably one of the most cutting-edge parts of this facility is your stem cells and the research you're doing there. Let's talk about that. What are stem cells?
So stem cells are basically immature cells that can morph and turn into different things like bone or cartilage or fat, for instance. So we've been using stem cells in the operating room on a daily basis for years, but what we are really interested in doing here is showing that we can use stem cells for different aspects of cartilage regeneration. So cartilage is found in between the bones and the spine, and they're basically like little shock absorbers or buffers. So we're looking to use our stem cells here to regenerate cartilage. And there's been some major research in this area over the past, probably 10 years. But we're pretty cutting edge when it comes to our stem cell program here.
How does the process work?
Well, the way the process works is first you have to be an appropriate patient for the actual procedure. So the first part of the procedure is actually the extraction of the cells, where the patient will come here and we put them under some gentle sedation, and then we extract the cells. And then the second part is basically separating the cells and storage of the cells and an expansion of the cells. After the cells have been expanded, then you'll have another procedure here where we re-inject the cells.
Wow. You said you determine if someone's a good candidate. What makes someone a good candidate for the stem cell process?
Well, there are other treatments, obviously, for back pain. So a good patient would be someone who's had a lot of treatment already, but they haven't gotten better with physical therapy or different types of injection procedures, and they're actually indicated by another surgeon or a patient in our practice that basically is indicated for surgery. So someone who's failed conservative treatment and is a candidate for surgery. So this is a way less invasive option to improve the patient's symptoms.
Where do you see the future of stem cells?
No one actually knows the future of stem cells, but what I believe is that as the regulations in the United States become a little bit more lax and we learn more about the potentials of these different treatments, that the United States government and the FDA will allow us to do more. So we've had it happen in other areas of medicine, basically, where the regulations have really suppressed the growth of a particular area of medicine. So, but I think that maybe in 10, 12 years that some of the treatments that we're doing here will be pretty much standard accepted practice.
Dr. Hayes, you specialize in endoscopic surgery. Tell us about that process.
After I learned how to do all these big reconstructive procedures in my spinal fellowship, which is a year after my residency, I wanted to learn other options and other minimally invasive ways to treat spinal disorders. So I spent some time in Arizona with Dr. Anthony Young, who's an expert in endoscopic surgery, and I learned how to do all different types of minimally invasive endoscopic surgeries. The difference between endoscopic surgery and an open surgery is that we don't cut the skin at all. We basically use percutaneous, which is real small access ports in the skin, and we use an endoscopic camera to aid us. It's almost like an arthroscopic procedure, like you would perform on someone's knee, but we do that in the spine. So that was the start of us getting involved in minimally invasive treatments, and then the stem cells are even less invasive because we're not using any surgical instruments really to perform the stem cell procedures.
Just a needle.
Just a needle to deliver the cells.